Great to see you. I've been trying to think of a really good April Fool's joke. Like look under your chair and, oh, if you see a red envelope, are you actually admitted or something like that? But I didn't think it'd go over very well. So I'm going to talk to you a little bit today about some of my research, and I'm going to kind of set the stage for how I think about obesity policy and then give you some examples of our work in this area and the actual research that we've done. So this is how we used to think about obesity from a public policy perspective. It was, all we really need to do is think about education. We have to get the food pyramid right. We have to think my plate. We have to really kind of push down this, give people the right information to get really good food choices. And the short answer is people were confused, right? They weren't sure if the red meant tear a thread or eat more fruit. This was the time where we saw obesity rates really skyrocketing. And so then we sort of stepped back and said, what is causing these skyrocketing obesity rates? And if we really want to solve it from a public policy perspective, how do we do so? And that's where we really started thinking about the food environment, or the larger environment in which these choices are made, and how that's shifted over time. And this means a couple different things, right? One of the things it means is prices and taxes, right? We know that's a big driver of people's food choice and is an environmental aspect out there. The other one is, let's think about things like food deserts and bringing supermarkets into high-need areas. This is one particular supermarket that we studied that went into the South Bronx here in New York City. The other thing you can think about is marketing, and in particular marketing to kids. Kids see thousands of ads every year. 98% of them are for unhealthy food. Who doesn't want to eat Pop-Tarts with Barbie on them? So this is, again, we know a really pervasive thing that drives food choice, particularly for kids. I'm going to tell you a little bit about our work on calorie labeling, which was first rolled out in New York City, again, with this idea of New York City being a big urban landscape for a lot of this stuff. And so we'll talk about some of our work in that. And then people who follow New York know the Mayor Bloomberg Big Gulp ban, which actually didn't influence big gulps at all, but did influence serving size of sugary beverages in fast food restaurants. And so I'll talk a little bit about our work looking at that. And then there was this idea of, what we really need to do is just have more bigger, hard-hitting kind of advertisement on this stuff. Forget about a food pyramid. Show a guy up there with his leg amputated. And this is something that the Department of Health here in New York City, great organization, leading health department in the world, I think, did. Although they got a lot of trouble because this guy actually didn't lose his leg and they just photoshopped it off. So that was problematic. But then the real question we try to look at is, does any of this work, right? These are innovative public policies. This is the first time we're trying to roll these things out and think about obesity and food choice from a policy perspective. So does some of this stuff actually work? And that's where our work comes in. So first I'm going to tell you a little bit about some work we've done evaluating calorie labeling. So for those of you who are new to New York, although these things are really rolling out across the nation now, this is a requirement that basically said for any chain restaurant, any place with more than 15 locations in the nation, you had to put up the calorie numbers on your menu item. All right, so this is it. Not huge, but you can see those sort of yellow numbers there from a McDonald's about how many calories were in there. And so we asked a couple different questions. We said, first of all, are people just seeing this information, right? Is it theirs? Are they absorbing it? And then how did it actually change calories purchased or not? Those were the kind of two basic questions that we asked. So look at that red line up there, that top red line. So this is before, right after, and then 3 or 4 or 5 years after labeling was actually implemented. And so what you see from that red line is that the percentage of people who actually saw labels does go up, right, to just over half the people who said, yes, I saw that information. Although 4 or 5 years later, it is starting to tick down, maybe not surprising. It's sort of old information anymore. You don't really notice it to the same extent you did. And then look at that green line. That's a percentage of people who actually said, yeah, I saw that information and I actually used it to make a healthier choice. Much smaller number there, right? We're talking about just under 10% of people who said, I saw the number and I used it to make a healthier choice. What we didn't see from this work is any change in the number of calories purchased. Sort of dark red is restaurants that had the information. The lighter red is those that didn't in the comparison communities. And what we found is really no statistically significant change or trends in terms of the number of calories purchased. So a first policy in this front and some work that says, all right, maybe we need to step back and really think about the effectiveness of something like this. So then we said, all right, so if just putting a number up there doesn't work, what might work? What might actually have a larger influences on people's food choice? And as much as we might try, we can't convince city policymakers to do everything we want. Mitchell can. He'll tell you about how he does it in a second, I think. So what we did is we actually said, let's set up a little bodega. Let's set up our own little, for those of you not from New York, bodega, sort of small corner store that sells beer and chips. So let's think about setting up our own bodega. So we went to Bellevue Hospital, which is the main public hospital in New York City. This is it, beautiful IMPay addition several years ago. And we took that little spot right there where that purple arrow is, and we set up our own bodega, right? It had all the stuff that traditional bodegas have, also had some healthy alternatives so we could at least some changes. And we played around with a couple different things. One of the things we played around with was forget numbers, let's just use this big red less healthy label, all right? And we actually found that this worked a little bit. Sort of 6 to 10% of people actually increased purchasing a healthier item. We also played around with taxes, right? So this is actually a change in the price of the item. Bigger percentage, sort of 12 to 15 percentage point increase in people purchasing a healthier item. So this gave us some sense of, maybe if this basic sense of just numbers don't work, which we know there are a lot of problems with, maybe something like this would, right? Maybe a more sort of visual way to display this information would have a larger influence. So again, a little more encouraging in this front. And then we did a little bit of work looking at the Bloomberg big portion cap policy, right? AKA the soda ban. And so we sort of said, what might this do if it happened? And it's important to say it almost happened, right? This is what Dunkin' Donuts was giving out the day before this policy was going to go into effect. Super complicated, right? We can't put sugar in if it's a large. You have to do that. If you get a Dunkin' we can only give you a smaller medium. It was this really complicated legislation they were really planning to roll out here. And so we did some work to say, what impact might this have, right? If this were to be implemented using what we know about how people actually purchase larger beverages, if 100% of the people on the left-hand side of your screen there actually did shift down to the 16 ounce, what would be the calorie savings? And it's pretty high, in the order of 60, 65 calories, all right? So under a lot of states of the world, this could be a policy that would be effective, although it was actually deemed inadmissible by the courts, largely based on the New York City method by which they passed this policy. So other folks are thinking a lot more about this. So I'm going to shift a little bit of the last thing I'm going to talk about is some of our work looking at the food environment and really sort of the access and availability of different food resources. And I think this is an important thing to highlight. One of the great things about being at Wagner in New York City is that we just have great data. I mean, this is a city that really has invested in understanding the health and welfare of their citizens in a really deep way. So this map, what it shows you is data. The underlying data for this are, we have, for all 1.1 million New York City public school kids, we have their height and weight. It's collected every year by the city. They give that data to us for research purposes. We know where these kids live, we know where they go to school, and we can make these really cool maps like this, where the darker red areas are things like higher obesity rates in that census tract, kind of small neighborhood area. The lighter blue areas, where we happen to be now, are much less than 10% of kids in that tract are obese, okay? So we can get this very rich sense of obesity, the obesity landscape across New York City. So that's great, but then what do we do about it, right? How can we know what's helping to drive or connected with some of these obesity changes? And what we do then is we look at, all right, let's see where these sort of food sources are. And this is bodegas, which are generally thought to be less healthy and generally are. We sort of can say, well, where did these bodegas come from? Like, where are they distributed throughout the city? So this is a heat map, essentially a map that sort of says, where do you see more of these controlling for population than you do in other parts of the city? And what do you see here, right? You sort of see northern Manhattan, South Bronx. You see sort of the central part of Brooklyn and Queens. If you go flip back and forth between this and the obesity maps, there tends to be kind of a correlation between those things. So maybe that tells us something's going on here. Then what about fast food places, right? Where do you see fast food places? Middle of Manhattan, where lots of people work, right? So, all right, maybe the trends aren't so easy then to really understand. And say, let's just map everything, right? We have this great, rich, detailed data from the city and state. Let's map every single food resource. What the heck do you do with that, right? It's sort of all over the place. And then you can also say, okay, let's look at just bodegas, right? What do you look at this? You say bodegas are everywhere, right? It would be hard to not find a bodega here. And then you look at things like medium-sized grocery stores. Maybe it's a little harder and you start seeing a little bit more of this geographic distribution. Then you can look at things like large grocery stores, and then there is even more of a geographic distribution. You're not seeing these in every neighborhood. So what we did is we wanted to look in and then fast food restaurants, you're back to everywhere. Right, so we wanted to actually connect these data on the food environment, connect these data on the kind of availability of food resources with the data on kids and where they lived, and eventually with their BMI, and see how do these things really connect with each other. So this is what I'm going to show you in my last couple slides. So all the way on the left is the distance in feet to the nearest food resource for every New York City public school kid, right? So what you see there is that purple line is distance to the nearest bodega. It's just under 600 feet, which is kind of just under 2 blocks on average. And then same thing for fast food restaurants, much farther for something like supermarkets, just because there are less of those throughout the city. And then we can say, okay, that's great, but what about these hypothesized differences with respect to race and ethnicity, with respect to the poverty status of the kid? And let's just look at poverty right now, all the way over on the right-hand side of your screen. What do you see there? You see that poor kids actually live closer to bodegas and fast food restaurants. That's generally what we hypothesize here. That's generally the story that's told in the policy world. But actually, in our case in New York City, they actually live closer to supermarkets as well. right? They tend to live in denser urban areas where there's lots of everything. So again, a really nuanced look you have to take at these data to really understand and drive policy in a larger way, and that's something we're spending a lot of time with. And then the other thing we can look at, and I think these are interesting just to see how, again, how dense a place like New York is. Here's the number of, again, bodegas, fast food, and supermarket within a quarter-mile buffer, so about 5 blocks around where the kids live, all right? So what you can see is within that 5 block, again, not just in one direction, every direction around where the kid lives, there's about 13 different bodegas, just over 14 fast food restaurants, and about 1.25 supermarkets, okay? So again, huge differences there in healthy and unhealthy food, and you see the same trends I saw you before, where actually, racial ethnic minorities, lower income are actually associated with having more of all of those things, including the more healthy food resources. So what does this mean? I think this really makes us want to look very deeply at this question, right? And both at challenging some of these assumptions about what it is, how food resources are distributed, what does it really mean for a place like New York and for other urban areas, and additionally, sort of what does that mean in terms of how this is actually causing some of these obesity changes or altering it? It's going to really alter obesity in a larger scale way. We work very closely with policymakers on this stuff. This project is in close collaboration with the New York City Department of Health and Mental Hygiene, who's very interested and engaged with this data and helping us to understand what's important for it better. And sort of the last thing to say is, politics is a really big part of this as well, And so this is something where you really do better understand, the connection between, like, I can sit up here and say, like, food resources are distributed this way, or you should do that, and people are going to say, like, I don't want this nanny state Bloomberg thing to really be able to drive what choices I make. And so that's another really important part of this as well. So I think Wagner's a place where you can really get that full sense of, what are the real drivers of choices here, what are the real drivers of some of these important outcomes, and how can we influence them in meaningful ways. Thanks a lot.